from Louisiana's home team. This is Fox 8 Morning Edition at 6 a.m.
In other news this morning, Louisiana has the second highest rate of diabetes-related deaths. And Dr. Scott Simeon with People's Health and Kenner Physician Associates is here to tell us how we can manage living with diabetes and try to reduce our risk of getting this condition. And Louisiana really high up there when we talk about diabetes. What is it about people in our state?
Well, a lot of it has to do with your diet. And, you know, we know that Louisiana has one of the highest, I don't know the exact statistics, but one of the highest rates of obesity in the country as well. So it sort of coincides with that. But, you know, diabetes is, the diabetes that we refer to most likely in these statistics is diabetes type 2, and which is traditionally known as adult onset diabetes.
Something that happens later on in life,
correct.
Not something you're born with, like
right. Well,
juvenile.
Type 1 diabetes is traditionally known as juvenile diabetes, and you're sort of born with it, and it's a condition where your pancreas just genetically is not programmed to produce insulin like it's supposed to. Type 2 diabetes has similar physiology, but it has to do also with the way your body uses the insulin that your pancreas produces. Your pancreas is an organ in your body that creates, that produces insulin, and insulin is sort of the key that pushes sugar from what you eat, and sugar that's broken down from carbohydrates, it pushes it into your cells and into your tissues to use it for fuel. I mean, we all need sugar. It's the basic fuel of what we eat, but it's also, if it's not used properly and if it's not pushed into cells by insulin, then it just sits in your bloodstream and does damage.
And what should we be doing to try to avoid this type of diabetes?
Well, exercise, of course. That's always.
You can't stress that enough.
You can't stress that enough. It's just and when we say exercise, I don't mean just joining a gym, but just be active. Don't just sit in front of the TV and have this be your only exercise. You know, have some actual activity and just simple things like park. Don't look for the closest parking spot. Park further away. Take those extra steps to walk to a store. You know, anything you do to remain active is going to help to burn off calories that you eat. And then, of course, diet. I tell all my patients that diet and exercise are the cornerstone of any diabetic treatment. You can take all the insulin shots you want and all the medicine you want, but if you're eating the wrong stuff, it's just not going to help. So that's the first step, is to eat the right foods.
All right. And I was just looking at some of the symptoms: increased thirst, frequent urination, extreme hunger. I mean, if you start to see some of these come on, then maybe you should go see your doctor and get a checkup.
Absolutely. In many cases, though, we do diagnose diabetes on routine blood testing. We'll see an elevated blood glucose, blood sugar, and then that will prompt us to order a more specific test for diabetes, typically something called a hemoglobin A1C, and if that's elevated, then it may mean you have diabetes. But we do see symptoms. In fact, just this past week, I saw somebody who had very typical textbook symptoms of diabetes, and sure enough, it was classic diabetes.
And I was just looking at the screen, the free seminar happening July 21st at 11 a.m. at the Kenner City Park Pavilion. Dr. Scott Simeon, thank you so much for joining us this morning. Always some good tips that we can use.
Thanks very much.